You see a young black woman kneeling in blood-soaked mud on a battlefield in 1864, her hands moving with impossible precision as cannonballs explode around her. And while everyone around her is running for cover, she's calmly extracting a bullet from a Union soldier's shoulder using instruments she sterilized herself in boiling water. A practice that wouldn't become medical standard for another 20 years. And this moment, this single act of brilliance under fire, represents just one day in the extraordinary life of a woman whose innovations saved thousands of lives during America's bloodiest conflict yet, whose name was deliberately erased from medical history books for over a century. Her name was Susie King Taylor, and she wasn't just a nurse, she was a medical revolutionary who pioneered sterile technique, developed triage systems still used today, and became the first black woman to publish a memoir about her Civil War experiences, all while being denied any official recognition, payment, or credit for her contributions because she had the audacity to be both black and female in an America that couldn't fathom that its medical innovations were coming from informally. Enslaved woman who taught herself to read in secret and transformed battlefield medicine through sheer genius and determination. But here's what makes her story even more remarkable, and what the history books conveniently forgot to mention. Susie King Taylor didn't just treat wounded soldiers, she completely reimagined how battlefield medicine could function, introducing concepts of hygiene and patient care that were considered radical, unnecessary, and even laughable by the white male doctors of her time. Yet her methods reduced infection rates so dramatically that soldiers specifically requested to be treated in the areas where she worked. You need to understand the context of what she was facing, because in 1862, when Susie King Taylor escaped slavery at age 14 and made her way to Union-controlled territory, medical science was still operating under theories that would horrify modern practitioners. Doctors didn't wash their hands between patients, the same surgical instruments were used on dozens of soldiers without cleaning, and the mortality rate from battlefield injuries wasn't primarily from the wounds themselves but from the infections that inevitably followed because nobody understood germ theory yet. And into this environment of medical ignorance stepped a teenage girl who'd been enslaved, who had no formal medical training whatsoever, who couldn't even legally acknowledge she could read and write, and she looked at the carnage around her and thought, there has to be a better way to do this. The year is 1863, and you're a Union soldier with the 33rd United States Colored Troops. You've just taken a musket ball to the leg during a skirmish outside Jacksonville, Florida, and you're being carried to the medical area expecting the usual treatment, which means a doctor with filthy hands and blood-crusted instruments will either dig around in your wound with his bare fingers or immediately decide to amputate, but instead you're brought to a section of camp where a young black woman greets you with calm authority, and the first thing she does, the very first thing that strikes you as strange, is she washes her hands in water she's boiled specifically for this purpose. Then she cleans your wound thoroughly, irrigating it with more boiled water, examining the injury with instruments she's heated in fire and cooled in clean water, and she speaks to you the entire time, explaining what she's doing and why, treating you not as a piece of damaged military equipment but as a human being, deserving of dignity and care. This was Susie King Taylor's revolution, and it was happening in real time while the medical establishment was still debating whether fresh air or bad air caused disease, still believing that pus in a wound was a good sign of healing, still using the same sponges to clean multiple wounds without ever washing them. And here was this formerly enslaved teenager who somehow understood principles of sterile technique that wouldn't be formally accepted by medical science until Joseph Lister published his findings on antiseptic surgery in 1867, 4 years after Susie had already been practicing these methods on the battlefield. But where did she learn this, you're wondering, because Susie King Taylor didn't attend medical school. She couldn't have. She was born into slavery in Georgia in 1848. She was legally prohibited from learning to read, yet somehow she not only taught herself literacy in secret but also developed an understanding of medicine that surpassed that of formally trained white doctors. And the answer reveals something profound about African American knowledge systems and survival strategies that existed parallel to and often superior to white institutional learning. Susie learned to read from a free black woman who ran a secret school in Savannah, risking severe punishment every single day she attended because teaching enslaved people to read was illegal and could result in brutal consequences for everyone involved. But Susie's family understood that knowledge was freedom, that education was resistance, so they made sure she had access to books, to information, to ideas, and Susie absorbed everything she could, reading medical texts, studying anatomy, diagrams, learning about herbal remedies from enslaved elders who carried African medical knowledge passed down through generations. And by the time she escaped to Union lines at 14, she possessed a hybrid medical knowledge that combined formal Western medicine with traditional African healing practices and her own innovative thinking. When Susie arrived at Camp Saxton with the 33rd United States Colored Troops, she immediately began working as a laundress and teacher for the regiment, because even in the Union Army, even fighting for her own freedom, a black woman couldn't hold an official position as a nurse. That would be too threatening to the racial hierarchy. But Susie didn't need official permission to save lives. She simply started doing the work, treating soldiers who came to her with injuries and illnesses, and word spread quickly through the regiment that this young black woman had healing abilities that exceeded anything the official medical corps could provide. Here's what Susie King Taylor innovated that transformed battlefield medicine. First, she insisted on cleanliness in an era when cleanliness was considered irrelevant to healing. She boiled water for cleaning wounds. She sterilized instruments using heat. She kept her medical area as clean as possible despite working in conditions of mud, blood, and chaos, and soldiers treated by her survived at rates that baffled the official doctors. Second, she developed an early triage system, quickly assessing which soldiers needed immediate intervention and which could wait, prioritizing treatment based on severity and survivability rather than rank or the order in which they arrived, a practice that seems obvious now but was revolutionary then when battlefield medicine was mostly chaotic and haphazard. Third, she treated patients holistically, understanding that psychological care mattered as much as physical treatment. She talked to soldiers, learned their names and stories, provided comfort and human connection during their most vulnerable moments. And this emotional support contributed to better outcomes because soldiers who felt cared for as individuals fought harder to survive. Fourth, she documented everything, keeping detailed notes on which treatments worked and which didn't, adjusting her practices based on observed outcomes, essentially conducting informal clinical trials decades before evidence-based medicine became standard practice. And fifth, perhaps most importantly, she trained other black women in her methods. She shared her knowledge freely with anyone willing to learn regardless of their race. And she created a legacy of medical excellence that rippled outward through the communities she touched. You need to grasp the magnitude of what Susie was accomplishing while receiving absolutely no recognition, no payment, no official status, because throughout her 3 years with the 33rd United States Colored Troops, from 1862 to 1865, she worked 7 days a week treating wounded and sick soldiers. She accompanied the regiment on dangerous expeditions. She operated under enemy fire. She survived yellow fever outbreaks that killed many around her. And she did all of this as a volunteer because the Army refused to officially pay black nurses. She supported herself by doing laundry and teaching when she wasn't saving lives. And the white medical establishment never once acknowledged her contributions or sought to learn from her methods. The 33rd Regiment knew her value, though. The soldiers called her our nurse, with a possessiveness that reflected their understanding that she was the difference between life and death, between keeping a limb or losing it, between surviving an infection or succumbing to it. And multiple soldiers wrote about her in their letters and diaries, crediting her with their survival, describing her courage under fire, noting how she would venture into dangerous areas to retrieve wounded men when everyone else had taken cover. One soldier wrote that Susie King Taylor had the courage of a warrior and the gentleness of a mother. Another noted that she could do more for a wounded man than any surgeon I ever saw. And a third simply stated, "She saved my life." Yet none of these testimonials made it into official military records because acknowledging that a formerly enslaved black woman was outperforming trained white doctors was simply too destabilizing to the racial order the country was trying to maintain. But Susie's revolution extended beyond medicine because while she was treating wounded soldiers and pioneering sterile technique, she was also teaching formerly enslaved people to read and write, running what was essentially a school for black soldiers and freed people within the regiment. And this educational work was just as revolutionary as her medical innovations because she was creating a literate, informed black community that could advocate for itself, document its own history, and fight for its own rights. Think about the intellectual courage this required, to look at the catastrophic failure of American medicine to prevent battlefield deaths from infection and say, I can do better, despite having no formal credentials, no official authority, no institutional support, and then to actually prove it through results, to develop methods that worked so well that they threatened the professional standing of formally trained white doctors who'd spent years in medical school yet couldn't match the outcomes of a formerly enslaved teenager with homemade instruments and boiled water. The Civil War ended in 1865, and you might think this was when Susie King Taylor finally received recognition for her contributions. When the Army thanked her for her service, paid her for her work, acknowledged her innovations, but instead the exact opposite happened. She was dismissed without ceremony, without compensation, without even a basic acknowledgement of what she'd accomplished, and the medical establishment immediately began the process of erasing her from the historical record, crediting white male doctors with innovations she'd pioneered, rewriting the story of battlefield medicine to exclude any mention of the black woman who'd revolutionized it. Susie refused to be erased, though, and in 1902, at age 54, she published her memoir Reminiscences of My Life in Camp with the 33rd United States Colored Troops, becoming the only black woman to publish a first-hand account of the Civil War from the Union side, and in this remarkable book, she documented everything: her escape from slavery, her work as a nurse and teacher, her innovations in medical care, the courage of black soldiers, and the brutal racism they faced from their own army even as they fought for the Union. The book received little attention when it was published because America in 1902 was in the midst of actively dismantling Reconstruction gains and reinstalling white supremacy through Jim Crow laws. The country didn't want to hear about black excellence, black innovation, or black contributions to Union victory. It wanted to believe that the Civil War was about states' rights and that black people had been passive recipients of freedom rather than active agents in their own liberation. So, Susie's memoir was largely ignored and then forgotten. For decades, for more than a century actually, Susie King Taylor's contributions to medicine remained buried. Her name appeared in no medical textbooks. No nursing schools taught her methods even though they'd been proven effective. No hospitals honored her legacy, and generations of medical students learned about Joseph Lister and Louis Pasteur and other white men who developed germ theory and sterile technique without ever hearing about the formerly enslaved black woman who'd been practicing these methods on Civil War battlefields before germ theory was even accepted science. This erasure was deliberate, systematic, and profoundly damaging because it reinforced the lie that medical innovation only comes from formally credentialed white men, that black people and especially black women are incapable of scientific thinking, that knowledge only counts when it emerges from universities and laboratories rather than from brilliant minds working under impossible conditions with limited resources. But here's what the erasure couldn't destroy. The soldiers Susie saved went home and told their families about the black nurse who'd saved their lives. Those families told their children, and those children told their children, and so Susie's legacy survived in oral histories and family stories even when it was absent from official records. Black communities remembered her even when white institutions forgot her, and slowly, painfully slowly, historians began rediscovering her memoir, recognizing her contributions, and demanding that she receive the recognition she'd always deserved. Modern research into Civil War medicine has confirmed what black soldiers knew all along: that Susie King Taylor's methods were medically sound and ahead of their time, that her emphasis on hygiene prevented countless deaths from infection, that her triage system improved survival rates, that her holistic approach to patient care addressed psychological factors that mainstream medicine was ignoring, and that her innovations deserve to be recognized as foundational contributions to modern nursing and battlefield medicine. The irony is devastating when you think about it, because if Susie King Taylor had been a white man with her exact same innovations, her name would be as familiar as Florence Nightingale or Clara Barton. Medical schools would be named after her. Nursing programs would study her methods, and her memoir would be required reading in history courses. But because she was a black woman, because she'd been enslaved, because her genius threatened the comfortable lie that scientific innovation was the exclusive domain of white men, she was systematically erased from the historical record, and only now, more than 150 years after her battlefield service, is she beginning to receive a fraction of the recognition she deserves. Today, when you enter a modern hospital and see staff washing their hands, when you watch surgical teams using sterile instruments, when you observe emergency rooms triaging patients by severity, when you notice healthcare providers treating patients with dignity and explaining procedures, you're witnessing the legacy of Susie King Taylor, a formerly enslaved black woman who revolutionized medicine without credentials, without recognition, without payment, and with very little acknowledgement from the people whose lives and practices her innovations transformed. Her story matters not just because it's a remarkable tale of individual genius overcoming impossible obstacles, though it certainly is that, but because it reveals the systematic erasure of black contributions to American progress. It exposes how white supremacy operates by stealing credit for black innovations. It demonstrates that formal education and institutional credentials are not the only sources of knowledge and excellence, and it proves that black people, especially black women, have been at the forefront of scientific and medical advancement throughout American history, even when that advancement was attributed to others. The next time someone suggests that black people haven't contributed to science and medicine, the next time you hear someone claim that medical innovation only happens in universities and research institutions, the next time anyone implies that formerly enslaved people were uneducated and incapable of complex thinking, remember Susie King Taylor. Remember that she was pioneering sterile technique on Civil War battlefields before it was accepted medical science. Remember that she saved thousands of lives while being denied any recognition or payment. Remember that she published the only first-hand account of the Civil War by a black woman because she understood that if black people don't document their own history, it will be erased and rewritten by others. And remember that her story is not unique. She represents countless black innovators whose contributions were stolen, credited to others, or simply forgotten because acknowledging black excellence was too threatening to white supremacy. Susie King Taylor died in 1912 at age 64. Having spent her later years working as a domestic servant in Boston, and when she died, her obituary made no mention of her revolutionary medical work, her pioneering innovations, or her crucial role in Union victory. It simply noted that she'd been a nurse during the Civil War, as if that modest description could possibly capture the magnitude of what she'd accomplished. And she was buried in an unmarked grave, her final resting place unknown, her contributions seemingly lost to history. But you know her story now, you know what she achieved and how she was erased, and that knowledge carries responsibility, the responsibility to remember, to share her story, to demand that black contributions to American progress be acknowledged and celebrated, to recognize that innovation and genius emerge from unexpected places and marginalized communities, to understand that systematic erasure is ongoing and must be actively resisted, and to honor Susie King Taylor's legacy by ensuring that future generations know her name, study her methods, and recognize her as the medical revolutionary she truly was, because her revolution didn't die with her. It lives on every time a medical professional washes their hands, every time a patient is treated with dignity, every time sterile technique saves a life, and every time we refuse to let black excellence be erased from the historical record. So share her story, speak her name, teach her history, and make sure that the black nurse who revolutionized battlefield medicine forever is never forgotten again.